Hello aspirants, welcome to GDC English classes and welcome to series of Pharma 360 degrees. In this session, we will focus on discussion on MCQs related to pharmacology from previous year question papers of Tamil Nadu MRB Pharmacist. I hope you are too busy with your preparation. You know that GDC is one of the platform across the India providing coaching for GPAT, NIPER, Drug Inspector, Pharmacist in Hindi as well as English language. So the English classes of GDC, especially for the South India students from the Kerala, Karnataka, Tamil Nadu, Andhra Pradesh as well as Telangana. I hope most of the people from South side they already know that the GDC is conducting classes in English language. If people still don't know, so give the awareness to them. So GDC English classes are available for GPAT, NIPER, Pharmacist, Drug Inspector coaching. And you know that the faculty in the GDC English class, they are already qualified from the GPAT as well as NIPER. Definitely, they will guide you in right way. So, in this point, nothing but in this session, we will focus on the previous year MCQs in Tamil Nadu MRB Pharmacist. Especially in this session, our focus on pharmacology related subjects. So, let's go into the further discussion along with the MCQs. So, here, the first MCQ is here. The quartan malaria fever is due to. So, quartan malaria fever is due to Plasmodium boviale, Plasmodium vivax, Plasmodium malariae, Plasmodium falciparum. So, these are the different species cause malaria and they comes under the Plasmodium. And especially here, quartan malaria, the meaning of quartan malaria. So, generally after treatment, malaria will control. But sometimes the fever may reoccur, recurrent fever. Here also, this fever, this type of fever may reoccur, may occur again, may happen again, may produce again after 4 days. So, quartan means a gap of 4 days. And here, the simple answer, so the quartan malaria fever is mainly because of one of the species is here, that is Plasmodium malariae. So, Plasmodium malariae causes this quartan malaria. And this is a simple explanation. So generally, malaria is a protozoal infection caused by the Plasmodium parasite. Malaria caused by 4 species of protozoal parasite like vivax, ovale, malaria, all these things you know that. And quartan malaria fever is caused by the parasite Plasmodium malariae. And going to the next MCQ. So regarding the next MCQ, dash are used for pyrogen testing. So this is a common question asking many times in the GPAT, NIPER, Pharmacist as well as Drug Inspector question papers. So the question is simply, which of the following animal is used for pyrogen testing? So mice, guinea pig, rabbits, rat. The simple answer is rabbits are useful for pyrogen testing in the pharmaceutical industry. So the answer is very simple, rabbits. So regarding pyrogen test mainly carried out in the rabbit. Fever response in rabbits 3 in number based on fever response, and temperature of individual should not change more than 0.6 degree for one rabbit, and sum of 3 should not be more than the 1.4 degrees within the 3 hours. So generally the test is a Lumulus amoebocyte lysate test. Okay, so this is a common question you can see in the question papers repeatedly. Next question. So regarding the next question, so here isoniazid is always preferred to be used for first 7 months in combination with to avoid development of resistance against the tubercular bacilli. So resistance is common thing. So resistance is nothing but a decreasing responsiveness of drug towards microorganism. Generally antibiotics effectively kills the microorganism, effectively remove the microorganism. But here the drug response is reducing because of resistance. The ability of drug is reducing against the organism. So rifampicin, ethambutol, pyrimethamine, streptomycin. Generally isoniazid is combined with rifampicin to reduce the resistance. If resistance is happen, the drug unable to show its effectiveness. So that's why instead of nothing but to prevent resistance, isoniazid should combine with the rifampicin. The answer is simply rifampicin. And as you all know that, so here rifampicin isoniazid combination commonly helps in the treatment of tuberculosis. It's commonly helps in the treatment of tuberculosis. So tuberculosis is caused by one of the bacterium, that is Mycobacterium tuberculei. It is a type of acid fast bacterium. Sorry. Next. So phenytoin is a dash derivative. So chemically, phenytoin is a simply hydantoin, benzodiazepine, succinate, barbiturates. So simply answer is a hydantoin. Phenytoin is chemically diphenyl hydantoin. 5,5' diphenyl hydantoin. Next. So this is the classification of antiepileptics along with their examples. The important point, especially the major advantages in the GDC classes. So you will go through the many number of MCQs videos along with the detailed explanation like this. So definitely like these videos will improve your ability to crack computer exams easily. Next question. So regarding next question, the following drugs are used in the treatment of malaria except. So chloroquine antimalarial drug, primaquine antimalarial, artesunate antimalarial, chloramphenicol. Generally chloramphenicol is an antibiotic. It is a protein synthesis inhibitor in the bacteria. So the answer is very simple. Chloramphenicol, it is an antibiotic. And this is a classification of antimalarial drugs based on chemistry. Next question. So here the neurotransmitter released in the neuromuscular junction. What is neuromuscular junction? It is a junction between neuron and muscle. The muscle is the skeletal muscle. Neuron is motor neuron. And here the neurotransmitter released is acetylcholine. The acetylcholine binds to nicotinic muscle receptors and shows muscle contraction. So simply dopamine, serotonin, acetylcholine, adrenaline. The answer is acetylcholine releases into the neuromuscular junction, bind to the nicotinic muscle receptors to produce muscle contraction. The answer is acetylcholine. So the answer is very simple. Next. So here loss of sense of smell is called as anosmia, aphasia, agasia, photophobia. So anosmia is generally loss of ability of taste of smell, and aphasia it is related to the hunger, and agasia is also related to the taste, and photophobia is related to the sensitivity towards light. Okay, phototoxicity. For example, when you applied some ointments on the skin, if you expose it to the sunlight, there is some reactions will occur, allergic reaction. That type of allergic reactions are known as photosensitive or photoallergic reaction. So here the question is loss of sense of smell is called as anosmia. That is loss of sense of smell. Anosmia. And agasia, nothing but dysgeusia, alteration in the smell, alteration in the taste, not smell. Agasia is related to the taste. Anosmia related to the smell. So here, anosmia, aphasia, agasia, simply. Okay. So anosmia means the medical term for the loss of the sense of smell, and aphasia is a language disorder that affects the person's ability to communication. Aphasia means alteration in the speech, jumbling speech. Okay, and coming to the photophobia. Photophobia is nothing but sensitive to the light. Sensitive to the light. Next question. So regarding the next question, what is this? Antidiuretic hormone axon, proximal convoluted collecting duct, ascending limb of loop of Henle, descending limb of loop of Henle. All these are the parts of nephron. So among these parts, our antidiuretic hormone acts on the collecting ducts. Antidiuretic hormone also known as vasopressin. This vasopressin prevents urine formation and increases reabsorption of water into the body along with the sodium. So simply antidiuretic hormone, nothing but vasopressin acts on collecting ducts of the nephron. Collecting ducts of the nephron. So here different parts of the nephron and along with the nephron diagram. Next question. So regarding the next question, first heart sound is due to closure of atrioventricular valves, semilunar valves, atrial contraction, ventricular filling. Generally, it is because of closing of valves. That is simply the first sound of the heart is because of atrioventricular valves closing. Atrioventricular valves closing. So here simply. So here ventricular contraction due to Ventricular contraction is due to wave of contraction stimulated by atrioventricular node. Bicuspid and tricuspid valve close, producing first heart sound, that is a lump. And coming to ventricular diastole, ventricular relaxation closing of semilunar valve causes second heart sound, that is dump. So lump as well as a dump. Next question. So regarding the next question, simple cuboidal epithelium is present in the below mentioned organ like thyroid follicles, skin, uterus as well as trachea. So generally simple cuboidal epithelium is present in the thyroid follicles and also most of the other glands also. Most of the other glands generally containing the simple cuboidal epithelium. So here the answer is thyroid follicles. So thyroid follicles contains simple cuboidal epithelium. Not only simple cuboidal epithelium, even lining of kidney tubules, ducts of various glands like salivary glands, sweat glands, thyroid gland follicles, they contains this type of epithelium. Next question. Hepatitis B is also known as infectious hepatitis, delta hepatitis, serum hepatitis, infectious and delta hepatitis. Generally, hepatitis B is known as a serum hepatitis. The other name of hepatitis B is also known as a serum hepatitis. So the answer is serum hepatitis. So let's have a discussion like hepatitis A, hepatitis B, hepatitis C. Also called hepatitis A, infectious hepatitis B, serum hepatitis C, non-commonly happened. And route of transmission of hepatitis A, fecal oral transmission due to contaminated food and water, and hepatitis B, blood sexual contact as well as through the mother to the child also, and especially hepatitis C through the blood to blood transfusion. Next, polyuria, polyphagia, polydipsia, common symptoms of tuberculosis, arthritis, diabetes, ulcers. So by seeing the MCQ itself, you can easily understand. So these are the signs, nothing but symptoms observed in case of diabetes. So polyuria, increasing number of urination, nothing but frequency of urination increases. Polyphagia, hunger increases. Polydipsia, thirst increases. Urge to take more water. So simply the answer is diabetes having this particular signs, SIGNS signs. So this is simply about diabetes mellitus. We know that diabetes mellitus is nothing but excess sugar levels in the blood. That is characterized by polyuria, frequent urination, polydipsia, increased thirst, polyphagia, increased hunger. Next question. So, which antihypertensive agent can be taken during the pregnant woman? The simple question is, which of the following antihypertensive drugs safe while taking in the pregnant woman? So, drugs like nifedipine, a vasodilator, propranolol, a beta blocker, thiazide, a diuretic, AC inhibitor, yes, a antihypertensive. Generally, drugs like nifedipine is safe to take in the pregnant woman to reduce hypertension. So, the simple answer is nifedipine. Nifedipine is chemically dihydroquinone. Nifedipine, amlodipine, felodipine, isradipine. There are many number of examples. Okay. So not only nifedipine, so drugs like levethalol, drugs like methyl-dopa are also choice to control hypertension in pregnant women. So methyl-dopa, levethalol as well as nifedipine. These are the drug of choice to control hypertension in pregnant women. Next question. Regarding the next question, any noxious change which is suspected to be due to a drug occurs at dose normally used in man is known as a noxious change, a unwanted change. So, adverse drug reaction, drug interaction, medication error, life-threatening reaction. Generally, noxious means it is not suitable for the body. So, simply that is a adverse drug reaction. Nothing but a type of allergic reaction. Sometimes it may be a idiosyncratic reaction. That is, there is no specific reason because of that reaction. So the answer is very simply, adverse drug reaction is a noxious change is suspected to be due to a drug occurs at doses normally used in the man. Even this type of adverse drug reactions occur at the normal doses. Okay. So this is simply about the adverse drug reaction. Next. So regarding the next MCQ, theophylline is a, so theophylline from the T source. So there is a caffeine, theophylline, theobromine. So they are natural alkaloid. Generally they are active constituents in the form of coffee as well as the tea. So methylxanthine derivative, beta 2 agonist, sympatholytic, parasympatholytic. So simply theophylline comes under a methylxanthine derivatives. So methylxanthines are CNS stimulants as well as they also having bronchodilator effect on the lungs, respiratory system. The answer is very clear. Theophylline is a methylxanthine derivative. Next question. Latanoprost. So drugs like latanoprost as well as bimatoprost, these are helps in the treatment of glaucoma. And especially here the question is latanoprost is a prostaglandin derivative, alpha adrenergic agonist, carbonic anhydrase inhibitor, beta blocker. So all this list of A, B, C, D options are category of drugs helps in the treatment of glaucoma. And here prostaglandin analogs like latanoprost helps in the treatment of glaucoma. So latanoprost is a prostaglandin analog, helps in the treatment of glaucoma along with the other list of drugs. The simple answer is latanoprost is a prostaglandin derivatives. Okay, next. Which of the following is a prodrug? So captopril, enalapril, hydrolazine, clonidine. So all are comes under antihypertensive agents. Among this, enalapril is regarded as a prodrug from the angiotensin converting enzyme inhibitors. All prils are angiotensin converting enzyme inhibitors. They helps in the treatment of hypertension. Next question. So this is the answer. Enalapril is a prodrug from this list of drugs. Option A, B, C, D. So here levodopa to dopamine, enalapril to enalaprilat, S-methyl-dopa to alpha-methyl norepinephrine, and dipivefrin to epinephrine. So this is a prodrug and this is the active form of drug. So in the our GPAT NIPER drug inspector pharmacist exam, so definitely you can expect questions from what is the prodrug and what is its active form. And you know that prodrug is nothing but inactive in nature. Once it's bypass the liver, converts to active form, that active form reaches the blood and shows its pharmacological action. Nothing but after reaching the tissue target shows its action. Pharmacodynamics. So pharmacodynamics nothing but actions. Pharmacokinetics nothing but absorption, distribution, metabolism, elimination. So pharmacodynamics, drug elimination, drug excretion, drug absorption. So elimination, excretion, absorption belongs to the pharmacokinetics. Mechanism of action comes under pharmacodynamics. Pharmacodynamic, what drug does to the body in the form of mechanism, in the form of therapeutic activity, in the form of adverse effect, in the form of allergic effect, etc. etc. So actions are pharmacodynamics and movements, absorption, distribution, metabolism, elimination are kinetics, pharmacokinetics. Okay. So simply pharmacodynamics, what the drug does to the body. Pharmacokinetics means what body does to the drug, how body absorbing the drug, like that. Next question. High efficacious and most commonly used LDL cholesterol lowering 𝘎𝐿-𝘾𝙎𝙎𝑃ase inhibitor. So high efficacious, having excellent efficacy in the form of action, and most commonly used LDL cholesterol lowering. LDL is a bad cholesterol. We should reduce LDL and we have to increase the HDL. HDL is a good cholesterol. It is a cardioprotective, reduce the risk of cardiovascular diseases. So here question is, so simply one of the following drug reduce the LDL and increase the HDL. It acts by inhibiting the HMG-CoA, hydroxymethyl glutaryl coenzyme So like lovastatin, simvastatin, atorvastatin as well as pravastatin. So all these are the statins commonly acts by inhibiting hydroxymethyl glutaryl coenzyme A. The enzyme is essential for formation of a rate-limiting product in the cholesterol biosynthesis. If this enzyme was inhibited, cholesterol biosynthesis will be reduced and automatically lipid-related disorders also controlled. So answer is simply atorvastatin, high efficacious, most commonly used LDL lowering and HDL increasing drug by inhibiting hydroxymethyl glutaryl coenzyme A enzyme. This enzyme is essential for cholesterol biosynthesis. So answer is simple, atorvastatin. Next, continuation. Prolonged use of hydrolyzing therapy is likely to develop thrombocytopenia, hemolytic anemia, gynecomastia, as well as lupus erythematosus. So hydrolyzing comes under a vasodilator. Hydrolyzing comes under vasodilator, helps in the treatment of hypertension. It commonly causes adverse effects like lupus erythematosus. Lupus erythematosus is a common drawback of this hydrolysine. So as I mentioned clearly, hydrolysine is a vasodilator, primarily treat hypertension and heart failure. One of the most important adverse effects associated with this prolonged use of hydrolysine is the development of lupus-like syndrome, which resembles systemic lupus erythematosus. Resembles systemic lupus erythematosus. Next. So, which of the following drug may causes reversible gynecomastia? So, omeprazole, pyranzapine, cimetidine, sucralfate. All these drugs helps in the treatment of a peptic ulcer in different ways. And here the question is, one of the following drug may cause reversible gynecomastia. What is gynecomastia? So, gynecomastia is nothing but a abnormal enlargement of breast in the males. So here the gynecomastia is a common problem with the cimetidine is a H2 receptor blocker, as well as it may also interfere with the testosterone function in the males, increase the domination of estrogen. Because of that abnormal enlargement of breast in the males. Okay, answer is simply cimetidine causes reversible gynecomastia. Next. Which of the following glucocorticoid is a long-acting drug like prednisolone, dexamethasone, triamcinolone, aldosterone? So which of the following glucocorticoid is a long-acting? So here drugs like dexamethasone, betamethasone are long-acting glucocorticoids. Glucocorticoids are having highly anti-inflammatory activity as well as immunosuppressant activity. Generally these are steroidal in nature. They contain steroid ring in their structure. Answer is very simple, dexamethasone. So here, long-acting glucocorticoids like dexamethasone as well as betamethasone. This is a classification of glucocorticoids as well as mineralocorticoid. Mineralocorticoid is nothing but a aldosterone naturally present in the body, helps in sodium and water reabsorption. Next question. So what is the question here? Macrolide antibiotic is erythromycin, pilocarpine, physostigmine, hyoscine. Hyoscine is an anticholinergic from the natural plant source, and physostigmine is also from the naturally plant source. It is a parasympathetic. Pilocarpine is also parasympathetic. So pilocarpine, physostigmine, hyoscine all are from plant source, and these are natural alkaloids. And here erythromycin is a antibiotic from the microbial source. So macrolide antibiotic is here erythromycin. Erythromycin is a protein synthesis in the bacteria by binding to 50S ribosomal subunit of bacteria. Answer is very simple. Erythromycin is a macrolide antibiotic. Because of their large ring structures, cyclic structure, they called as macrolides, and it is a macrolide antibiotic. Next question. Influenza antiviral drug. So here the antiviral drug helps in the treatment of influenza. So which one that? So amlodipine is a calcium channel blocker in treatment of hypertension. Nifedipine is also calcium channel blocker in the treatment of hypertension. Amantadine, it is an antiviral drug, helps in the treatment of influenza, viral infection, as well as this amantadine also anti-Parkinson activity also. So remember, amantadine is an antiviral drug having anti-Parkinson activity also. And felodipine is also calcium channel blocker. Felodipine, nifedipine, amlodipine, these are chemically dihydropyridines. They blocks calcium channels, helps in the treatment of hypertension. So the answer is very simple. That is amantadine helps in treatment of influenza because of its antiviral activity. Next. So this is the classification of antiviral drugs based on its clinical use. So acts on herpes viral infections, influenza viral infection, and hepatitis viral infections. Okay. And anti-epileptics. So the last question from our discussion is anti-epileptics are reference to analeptics. Analeptics are reference to anti-epileptics, central nervous system depressant, anesthetic agents, central nervous system stimulants. So analeptics are referring to the central nervous system stimulants. By acting on the central nervous system, they stimulate the respiratory system. Especially analeptics are used in case of neonatal respiratory failure. Sometimes there is a respiratory failure problem in newborn babies. In that newborn babies, these analeptics are used. How these analeptics are stimulating the failure respiratory system to the working respiratory system, because Here, these analeptics, by acting on the central nervous system, they stimulate a respiratory center in the medulla oblongata. By that stimulation, they stimulate the lungs activity. So, analeptics are the drugs. They regarded as a central nervous system stimulants because especially these analeptics are the drugs used in newborn baby respiratory failure. They stimulate respiratory system by acting on CNS. Acting on CNS. So this is regarding discussion of our MCQs. I hope you understand our MCQs and you got the perfect answers with explanation. So continue your preparation. Subscribe to GDC English classes. All the best.